Hello, this is Dr. Ethan Spencer. Have you ever imagined that by taking a pill to sleep better tonight, you could be, without knowing it, erasing your memories of tomorrow? Or perhaps more immediately, feeding that brain fog that keeps you from thinking clearly during the day? And what if I told you that science is showing this is real and tangible? A new 2024 study published in the prestigious journal JAMA Neurology reinforced the dangerous link between the continuous use of these medications and brain atrophy, the shrinking of your brain, which can increase the risk of dementia by up to 50%. That's a lot, isn't it? In today's video, I'm going to tell you about the 5 groups of medications that may be causing inflammation in your brain. And very importantly, I'm going to introduce you to the secret scoreboard, the anticholinergic cognitive burden scale that scientists use to measure this risk. And you will finally understand how to protect yourself and your family from this terrible disease that affects millions of people. And I guarantee that the #1 drug on our list will shock you. It's something that millions of Brazilians buy without a prescription, thinking it's harmless, but that carries the maximum risk score for your brain. As a cardiologist, my duty is to alert you to what's behind it. But first, if this alert already makes sense to you, go ahead and like the video and subscribe to the channel so you don't miss any health tips that could save your life. Activate the notification bell to be the first to know, and spread this knowledge. Think about your parents, grandparents, uncles, aunts, ... Who do you love that takes several medications? Sharing this video in the family group is an act of care, so share it, and tell me, do you or someone you love frequently use any medication for sleep, allergies, or anxiety? And from which part of Brazil or the world are you? Write it down below. What causes dementia? The role of anticholinergic drugs. Let's go. First, let's understand what an anticholinergic drug is and why this name is so important for your memory. Think that your brain needs several building blocks to construct memory and focus. One of them is acetylcholine. To have memory, you need acetylcholine working well. To have acetylcholine, your body needs to produce it from choline that you ingest. Where do we find choline? In foods like eggs, especially in the yolk, liver, meats, fish, soy, and vegetables like broccoli and cauliflower. An anticholinergic drug smashes this block, which is acetylcholine, grinds it down. It turns to powder. The result: the memory of that person's name or the command to focus on this task is lost. That's why sometimes we feel that mental fog or the word is on the tip of the tongue. Your most important thoughts are always being misplaced. You might ask me, how exactly does this blocking these anticholinergic medications lead to brain shrinkage, types of dementia, Alzheimer's, vascular, and the link with medication? Recent neuroimaging studies are revealing the grim truth. Chronic blockage of acetylcholine not only harms communication, it seems to increase brain inflammation and, most alarmingly, can accelerate the accumulation of beta-amyloid plaques, the same plaques that are the hallmark of Alzheimer's disease. But another article published in JAMA in 2025 found an even stronger association between these drugs and vascular dementia. This suggests that the damage mechanism may be dual. In addition to sabotaging neural communication, these drugs may be contributing to inflammatory and vascular changes in the brain, impairing blood flow and the health of small cerebral vessels. To measure this damage, scientists created the anticholinergic cognitive burden (ACB) scale, a scoreboard from 1, 2, 3. The higher the score, the greater the danger. Now, before I give you the list, I want this to become personal. I challenge you to audit your medicine box with me right now. Pause the video if necessary. Go to your cabinet, grab that box where you keep everything. I'll wait. From now on, for each item on the list, you will look at your medications and see if you find a hidden villain. Deal now, a secret. Ignore the big name on the front of the box. The brand name is marketing. What you need is to be a detective and find the active ingredient or composition. It's usually in smaller letters, on the side or back. If you find any of them, note the score. Great. Now let's go hunting. Starting with number 5.5, TH Place, medication for urinary incontinence, oxybutynin, the 5th drug that increases dementia risk. Medications for urinary incontinence. Many of the drugs prescribed for this are potent anticholinergics. They relax the bladder muscle, but to do so, they block acetylcholine throughout the body, including the brain. Millions of people use drugs like oxybutynin to control overactive bladder. They are effective, but the price is high. They carry a score of 3, the maximum, on the brain risk scale. Before accepting, talk to your doctor about safer alternatives like mirabegron, which has a score of 0, or about pelvic physiotherapy and Kegel exercises, which are effective. But there's no point in protecting your brain from the bladder drug if you continue to use, perhaps every week, a medication for a much more common problem. Which brings us to item 4.4 th place, medication for cramps, buscopan. Scopolamine, the fourth drug that increases dementia risk, medications for cramps and irritable bowel syndrome. You know that famous drug for cramps? Many act as relaxing the intestinal muscles by blocking acetylcholine. The most common is buscopan and its generics, whose active ingredient is scopolamine, which relaxes your muscles. The problem, it also relaxes communication in your brain. It has a score of 1. It doesn't seem like much, but chronic use is like a constant drip of risk. For IBS, talk to your doctor about peppermint oil, probiotics, and dietary changes and, above all, stress management. You may have already used this type of medication yourself, and you might have been surprised to hear it mentioned here. If something as simple as a cramp medication is enough to raise concern, then you really need to pay attention to what comes next. The next category is where things get more serious because it involves medications that millions of people take daily for their mental health. Medications that can be life-changing in one way, but silently harmful in another. And some of these carry the maximum danger score when it comes to your brain. 3. RD, place, antidepressants and anti-anxiety drugs, amitriptyline and others. The third category of drugs that can increase your risk of dementia includes certain antidepressants and anxiolytics. Older antidepressants from the tricyclic class have a strong anticholinergic effect. Examples include amitriptyline and clomipramine, both of which are still prescribed today, often for depression, chronic pain, or even migraine prevention. There is also hydroxyzine, an older antihistamine, often given for anxiety, itching, or allergies. All three of these score a 3 on the anticholinergic cognitive burden scale, which means they carry the highest possible risk rating for brain health. Why does this matter? These drugs don't just affect your mood, they interfere with acetylcholine, the neurotransmitter your brain depends on for focus, learning, and memory. Blocking this signal day after day is like slowly cutting the power to the lights in a building. At first, you might not notice, but over time, entire floors go dark. It's crucial to note, never stop psychiatric medications abruptly. Doing so can be dangerous for both your mental and physical health. But there's good news. There are modern alternatives that do not carry this same risk. Medications like sertraline, escitalopram, and vortioxetine have 0 anticholinergic burden. For anxiety and insomnia, trazodone is often a safer choice, with minimal or no effect on acetylcholine. I once had a patient, let's call her Margaret, who had been on amitriptyline for years to manage both depression and chronic headaches. Over time, she began noticing more and more senior moments, forgetting appointments, misplacing items, repeating herself. After reviewing her medications, we switched her to escitalopram. Within weeks, she reported her mind felt clearer, and her focus returned, even though her mood stayed stable. To ND place, muscle relaxants, cyclobenzaprine, and similar drugs now. Let's move on to muscle relaxants, which take the second spot on our list. These are medications like cyclobenzaprine, known in some countries as Myozin or Myoflex, are widely prescribed for back pain, neck stiffness, or muscle spasms. Many people are prescribed these after an injury or during a flare-up of chronic pain. While they can provide short-term relief, muscle relaxants also block acetylcholine and depress the central nervous system, earning them a score of 3, the maximum risk. That drowsiness or heavy feeling you get after taking one isn't just relaxation. It's a sign your brain's normal communication is being dampened. Occasional use may be fine, but chronic or frequent use can be dangerous for your memory and mental sharpness. Think of it this way. Your muscles might be looser, but your brain's wiring is also being loosened, and that's not a good thing. For long-term back or neck pain, the safer route is to treat the cause. Physical therapy, posture correction, targeted strengthening exercises, and safer pain medications are all better options. Many patients see greater, longer-lasting improvements when they address the underlying issue instead of masking symptoms. With sedation, I recall a patient named James who had been taking cyclobenzaprine almost daily for over a year due to chronic neck pain. He started noticing trouble, remembering people's names at work, and often lost his train of thought after we slowly phased him off the drug and focused on physiotherapy and core strengthening. His cognitive clarity improved noticeably. First place, the harmless over-the-counter culprit, diphenhydramine and dimenhydrinate. Now we reach number 1, the winner in the worst possible way. This position goes to drugs that are so common and so accessible that people rarely think twice about them. Diphenhydramine and dimenhydrinate. Diphenhydramine is found in many PM, over-the-counter sleep aids and allergy medications, like Benadryl. Dimenhydrinate is best known as Dramamine, used for motion sickness and nausea. Both of these drugs are extremely potent anticholinergics, scoring a full 3 on the ACB scale. They easily cross the blood-brain barrier, meaning they act directly on your brain tissue. The drowsiness they cause isn't just sedation, it's a sign that acetylcholine, your brain's memory signal, is being actively blocked. Occasional use for travel or allergies is generally safe, but using them nightly for sleep is like giving your brain a steady drip of one of the most potent dementia risk factors known to medicine. Safer alternatives exist. For allergies, loratadine and fexofenadine are modern antihistamines with a score of 0. For sleep, look at your habits. Avoid caffeine late in the day. Keep a consistent bedtime, dim lights before bed, and consider melatonin or magnesium instead. I've seen patients who were unknowingly harming their cognitive health by using half a tablet of a diphenhydramine-based sleep aid every night for years. Once they stopped and addressed their sleep hygiene, they not only slept better but also felt sharper and more energetic during the day. The additive risk that most people ignore here is something few people realize. The scores from different medications add up. If you take a bladder medication with a score of 3, a cramp medication with a score of 1, and a sleep aid with a score of 3, your total daily score is 7, more than double the danger threshold. Research is crystal clear. Maintaining a score of 3 or more over long periods is strongly linked to cognitive decline and even structural changes in the brain. MRI scans have shown measurable shrinkage in brain areas critical for memory in people with high cumulative scores. One well-known case in my practice was a man, I'll call Robert, 78 years old, still very active physically. Over the past few years, his family noticed his memory slipping. They thought it was just age. But Robert also had long-standing insomnia and took a harmless over-the-counter pill every night. After reviewing his medications, we found his cumulative anticholinergic score was 6. We switched his sleep aid, reduced other risky medications, and while we couldn't reverse all the damage, his decline slowed and his daily functioning improved. So, as we have seen in our complete medication audit, there are many risks hidden in plain sight. These drugs are not rare. They are found in countless households, prescribed by doctors for a variety of reasons, and sometimes purchased over the counter without a second thought. The goal here is not to create panic, it is to raise awareness. Awareness is what empowers you to make safer choices, to ask better questions, and to protect your brain health for the long run. Here's one of the most critical points that very few people ever learn. The cumulative effect of these drugs is what makes them so dangerous. If you found a cramp medication with a score of 1, and maybe you're also taking a muscle relaxant with a score of 3 for your back, your risk is not 1 or 3, it's 4. And this is just from 2 medications. Imagine if you add an sleep aid or an older antidepressant to that list. The total score climbs quickly. Why is this number so important? Because studies show that a total daily anticholinergic burden score of 3 or more, sustained over time, is linked to measurable damage to brain cells. It's the equivalent of giving your brain a small dose of toxin every single day. One dose might not make much difference, but the cumulative effect of daily exposure is like slowly dripping acid on a delicate surface. Eventually, it leaves permanent marks. This is why doing a full audit of your medicine cabinet, and not just once, but periodically, is so vital. Medications change, prescriptions get added, and what might have been a low score a year ago can creep up without you noticing. If you still have doubts, let me share a case that mirrors what I've seen many times in real life. Think of someone like Uncle Robert, who I mentioned earlier, a man in his late 70s, once energetic and mentally sharp. Over the past few years, his memory started slipping, At first it was minor, misplacing his glasses, forgetting the names of neighbors. His family chalked it up to normal aging. But Robert also suffered from chronic insomnia and had been taking just one little pill every night for years to help him sleep. That pill, a diphenhydramine-based sleep aid, was quietly undermining his cognitive health night after night. By the time the connection was made, his score was well above 5 daily. And although stopping the drug helped slow his decline, some of the damage was irreversible. The 10% statistic that should make you pay attention, perhaps the most shocking data point, is this. Researchers estimate that about 10% of all dementia diagnoses can be directly linked to anticholinergic drug use. That's 1 in 10 cases that might have been preventable simply by adjusting medications. To put that into perspective, this risk level is on par with other major dementia risk factors like high blood pressure and diabetes. Think about what that means. If you or someone you love is taking one or more of these high-scored drugs, you could potentially reduce your risk significantly just by switching to safer alternatives. That's why this information matters so much. The principle of smart substitution brings us to one of the most powerful strategies in medicine. Most patients have never heard about the principle of smart substitution. This principle is not about giving up treatment. It's not about toughing it out without medication. It's about upgrading, replacing a drug that carries a hidden cost to your brain with one that works just as well, or sometimes even better, without that cost. If you're taking a high-score medication, don't stop on your own. That can be dangerous. Instead, talk to your doctor and ask 2 key questions. What is my anticholinergic burden score? Are there safer alternatives that could work for me? The answer might be as simple as switching from an older antihistamine to a newer one, from a tricyclic antidepressant to a modern SSRI, or from a muscle relaxant to a physical therapy program. These swaps can make a significant difference in your brain health over time, protecting your brain going forward now that you know what to avoid. The next question is, what can you actively do to protect and strengthen your brain? This is where lifestyle comes into play. Your brain thrives on regular physical activity that increases blood flow and oxygen delivery. A nutrient-rich diet that provides choline for acetylcholine production from foods like eggs, fish, and leafy greens. Adequate, high-quality sleep without relying on sedating, high-score medications. Mental stimulation, learning new skills, reading, problem-solving, to build cognitive reserves. Managing cardiovascular health, since what's good for your heart is good for your brain. We've covered a lot today. You've learned that certain common medications for bladder issues, digestive cramps, mental health, muscle pain, and even allergies or sleep can carry significant hidden risks for your brain. You've learned about the anticholinergic cognitive burden scale, how scores add up, and why keeping your total daily score under 3 is critical for long-term cognitive health. And you've seen real-world examples of how ignoring this can lead to preventable decline. If there's one takeaway I want you to remember, it's this. Awareness plus action equals protection. Awareness of the risk these drugs pose, and action in the form of smart substitutions and lifestyle choices, can help safeguard your memory and mental sharpness well into the future. So here's my challenge to you. Audit your medications this week. Write down your scores. Talk to your doctor about lowering that total. Share this information with the people you care about, because protecting someone's brain is one of the greatest gifts you can give. Thank you for watching and for taking your brain health seriously. I'm Dr. Ethan Spencer, and I'll see you in the next video. Stay sharp, stay healthy, and take care of your mind. It's the only one you've got.